common to hear people talking about Canada as a modern society. But without getting technical, it's more accurate to describe us as a postmodern society. Countries like China and India, which are going through tremendous growth, industrialization, and the development of social and physical infrastructure, are more modern societies. And they're going through many of the same processes that we went through in the 1950s, 60s, 70s to some extent, and some of the growing pains that we went through. And Canada is an example, and so is the United States, much of Europe, of these postmodern societies that are actually revisiting some of the thinking we had, some of the great fervor we had for handing things off always to government and creating large systems, substantial systems. So we haven't really stopped evolving in terms of our views of mental health, and a lot of what we thought we knew is being questioned. One of the things that makes us a postmodern society is that we're a multicultural society. We aren't just that Western society I spoke of in one of our earlier slides. In fact, we are a whole combination of cultural groups, and Canada is set apart to some extent from the United States in this as well. The United States uses an approach called the melting pot. People who immigrate to the United States know before they ever come there that the expectation will be one of assimilating to that culture, trying to adopt the American way of life, if you will. Whereas in Canada, we literally market to other countries this idea of multiculturalism. And so that people are told that they can bring their traditional views with them, their traditional cultural practices with them to Canada. So the residue of all these traditional old views continue to influence people when they are here in Canada. And this can create some really significant challenges as they try to cope with health, for example, or financial problems, or housing problems, or relationship problems, using cultural approaches that were acceptable in their country of origin, but may conflict with the ones here in Canada. And that becomes even more apparent when they begin having children that are now first-generation Canadians. Those children are going to be exposed to our media, our school system, and to peer groups that are going to really socialize them to a more westernized view of mental health and health, period. And that can create some real intergenerational confusion and conflict in those households, because people often want to do things the old ways if they're in the older generation, and the younger generation cannot relate. And I've seen this in my practice consistently. So for example, I remember a family that came to see me with a young man. They were of Chinese descent, and the parents did not speak very much English at all. So they had their eldest daughter act as the liaison between the parents and the agency program that I operated. And it was more than just a language barrier that created some conflicts. There were definitely differences from a cultural perspective. So one of the underpinnings of this program was that we taught people life skills such as cooking and shopping for groceries and menu planning and nutrition. But this family really wanted strongly to keep their child eating their traditional diet. And so they decided they weren't going to participate in this aspect of the program. The first problem was that was a significant amount of the time of the program, but the other problem was that their child was around while everybody else was eating cookies and French fries and sort of westernized foods, while he was eating his traditional diet literally out of a thermos every day. And you can imagine the sort of social disruption that this created. And in many cases, he became very upset, and we actually had to deal with aggressive behavior on many occasions because this individual could not understand why he couldn't participate and why he couldn't eat some of these foods. And it was a real challenge to support that individual because we really didn't have a good explanation for him as to why that happened. So that's just one example of how it can be difficult for people generationally to get past what we call the immigration effect, this idea that we have to adjust to a new way of thinking once we're in a new country. Another aspect of postmodern society is the burgeoning use of the internet as a source of information and, unfortunately, misinformation. On the one hand, it can be a very healthy thing that a person can truly sit at a computer and find out a great deal about the approaches that are being suggested to them by doctors and counselors, things like medications and so forth. But because there's so much misinformation and because it's so difficult to be able to tell the good from the bad, many people actually make very poor choices based on information they consider to be reliable. And again, perhaps a story is the best way of reflecting this. An example of this is an individual with whom I was working, who read on the internet that the medications for schizophrenia were poisonous, and that the better approach was to eat brown rice and to take a large amount of niacin. And the individual, as a result of the decision to follow that information, decompensated very severely, and as a result really damaged their relationships with other people, and really couldn't recapture them, and similarly couldn't recapture their health when they later on went back onto the pharmaceutical types of medication. It was really almost impossible to restabilize that person. So the internet can be a tremendous asset, but it is also something we need to be aware of, because people will often go on and read information that is extremely accessible, extremely available, and yet it will be misleading and sometimes dangerous. Another aspect of the postmodern society that we need to think about is the fact that we have sort of returned to a predominantly crime and punishment model. As I said earlier, we've lost faith to a large extent in government institutions, including very massive approaches to healthcare. If you live in the Fraser Valley, then you're probably familiar with an area called Essendale, which was characterized by Crease Clinic, Riverview Hospital, Valley View Hospital, and Colony Farm. A very large community, almost looked like a village really, in providing services to people with mental health needs. And for very good reasons, we became disillusioned with that large institutional approach. But by contrast, what we did was not really address people's needs effectively in the community either. And many people with mental health needs found themselves inadequately served and on the street. They became very visible. And to the average citizen walking past somebody panhandling or using drugs in the middle of a community, there was much more of an overwhelming response than anything else there. People really couldn't imagine how they might work with that individual or support that individual. It wasn't something that they could sort of access mentally to think about how they could help that person. And instead, the most easy thing to do, the first person we can always call and that has to come, is a police officer. And so you dial 911 and an ambulance comes, or a fire truck comes, or a police officer comes. And as a result, this is what's become the predominant way for helping people who are in crisis with mental health needs. It has really become the place where we have put our tax resources. And this has been a prominent underpinning of the platforms in both American and Canadian governments that have been elected in the last decade. People have really promoted a crime and punishment model as opposed to a preventative model or a social services model. And people have moved away from having faith in the idea that we might be good Samaritans or good neighbors as a way of reducing crime and disruptive behavior in our community. And instead, we really want to try and apply punishment. The problem with this is that research shows punishment is not very effective. And in fact, many people that leave prisons go right back out and commit crimes again. The recidivism rates in prisons are huge, and they're often characterized as essentially crime universities. People go there and they may be small crime or petty criminals, but they often learn from others there the patterns of socialization that lead them to more serious crimes. One of the other things we need to understand is that people are often perceive that crime is actually more common in our society today than it once was, particularly violent crime. And the fact is the research does not support this. The research demonstrates that we actually have smaller amounts or less amounts of violent crime than we once did, but that people's perception is that we have more than we once did. So we see less murder, less rape, less assault, but people believe we're seeing more. Why? Well, it's because of something called the availability bias. And as we get into our slides later on, we're going to learn more about cognitive biases. The availability bias is one of them. And the way it works is this. The more we see something in the news, the more we believe it is common. But of course, the news media works the opposite of that. The news media puts things in the news that are remarkable, that are newsworthy. In other words, they're somewhat rare and unique. But we don't think that way. We think if it's on the news, it must be something that's happening frequently. The more we see it on the news, the more it must be an issue. And so you can see why we're moving more and more and more to a model that allocates our resources to dealing with crime from a punishment perspective. We talked about this a little bit earlier, that we've, as part of our postmodern development, we've really become distrustful of institutions, perceived authority, and large organizations. Those include doctors, police, and government. And so when we think about it, we've lost faith in some of these entities that we create to help us feel secure and to maintain order in our society. And we devote tremendous amounts of resources to these particular institutions. But people have lost faith in them, particularly in the last of those three, in the government itself. And yet, nothing fills the void, with the possible exception of the internet and the entertainment media. And this is a very dangerous trend, because we don't have anything that we can trust, and yet we are still distrusting some of the conventions that we have invested in. Finally, we want to talk about economic pressures that have caused a reduction in our services. And we have less and less people putting money into the tax pool and more people taking out of the tax pool. And that's not a political statement, that's a demographic statement. Because in 1965, 1966, the end of the baby boom was realized. And so what happened is all those folks from 1966 into the 1980s and 90s began really populating the world with resources. We paid for schools and hospitals and highways and parks, and we put a lot of money into both the commercial estate as well as into the government estate. But what started to happen is all those folks started to retire and started to get older and sicker, and they started needing less schools and more hospitals. And so this required us to start really thinking about where we're going to allocate our resources. And anything that was basically seen as supporting people with mental illness was perceived as being, in many cases, not very cost effective. And in many ways, we saw people who were mentally ill as burdens on our community, particularly people who were addicted, or people who may have had behavior that led them to the streets, such as people experiencing disorganized type schizophrenia. And so those folks were often seen as being troublesome, and less resources were given to them, or there were more stringent screening mechanisms, more difficulty accessing that care. And this is a really troubling trend, because that population shift isn't changing anytime soon. In fact, it's continuing to worsen, and so it's expected that we're going to need to spend more and more money on our aging population, and that means that there's few of us paying for a larger number, and there's probably going to be less services for our young people. Remember what we learned: mental illness has its most common onset in youth and early adulthood. So this is a troubling trend for sure. So who has mental health needs? We want to ask you to use your journal and work alone. This is just a very quick write. We want you to brainstorm for 60 seconds for each of the following questions. What are the resources in your life that help you maintain good emotional and mental health? Think of everything that you can imagine that helps you to do that. What are the elements in your life that threaten your mental health? And what do you think might happen to you if these threats and resources were taken out of balance? So as you can see, we're going to move into a new direction now, thinking about mental health needs and the forms of care that work the best. So take a moment to answer those, and then move on to the next portion of the video.